When I first started in my training, nurses were my partners. I never felt that they weren't, but I also felt that the responsibility was mine and that they were helping me make decisions. So developing more relationships with nursing in particular has enabled me to see more about the patient. It's a shift from being the physician in charge of care to being a physician who participates in care. To do that, you have to take off the physician hat as a director of therapy and put on the cloak of being there for them. And when you do that, the partnership with all the other caretakers becomes key.
Partnership is essential because each of those key care providers brings a level of expertise blended into an individual care plan crafted for the patient.
It was important for me to be part of a well-functioning team, and then as I grew into that, to be part of what made that team work better.
I heard a saying once that people don't mind change, they just don't want to be changed. And I think that's really true. Change is a constant in our environment. So how do you get staff bought into that change? You need to get right there with the staff because the organization is only going to be as good as where the patients and the caregivers meet. So you have to get the frontline staff involved. They've got to be leaders because otherwise you won't sustain your improvement.
We utilized frontline nurses to really change patient care. They were typically informal leaders who were able to mentor, educate, and influence the care of their colleagues. They were able to spread the practice both by modeling the way and also educating and giving feedback to their colleagues.
I discovered a gift that I had. I would never describe myself as a leader, but to learn how to communicate, how to coach, how to put together a presentation, how to take research and evidence-based and then put it into practice, and then to be able to impart that on my coworkers. I learned the tools. I was given those leadership skills to be able to do that.
The future of healthcare is about empowering people at the bedside. The solutions come from the bedside, not from the C-suite.
Once the nurses understood that by simply having an improved surveillance on their patients, they understood the role they could play in increasing survival. In the past, the screen was used kind of in a checkbox mentality. Now when a patient developed a sepsis screen, the nurse had a standard procedure to follow to bring resources to the patient's bedside. It teaches them how to embrace evidence-based practice. They can take what they learn through this initiative and apply it to many different patient care improvements for other diseases. It creates in them an understanding and a hunger to provide better patient care, using what they have learned and really applying it to patient care in any setting.
We've seen our nursing staff move from task-oriented to really critical thinking, using the skills that they have gained through our grant work and through our checklists, order sets, and standardized procedures to improve care. They feel confident reaching out to other care providers to validate their concerns about a patient's changing condition. All of this work together and the partnership has really helped us to reduce length of stay for some of our patients, improve their mortality, reduce errors, and make patient care a much safer environment.
Working as a team, we can collaborate on what is the best plan for the patient, including the family, and the outcome is better. We get them out of the ICU sooner. They don't suffer post-traumatic syndrome. They don't have the muscle weakness that they would normally get. I recall a case where a patient was not able to be weaned off the ventilator. We could not remove some of her sedation because she was just getting so agitated. And I said, I think maybe all she just wants to do is sit on the edge of the bed. So that's what we did. Got her calmed a little bit, talked her through it. The next day, she was completely off the medication and we were able to extubate her. If we didn't understand the concepts of the ICU liberation, of getting our patients off of the sedation sooner, trying to wean them off the ventilator sooner, doing early mobilization, that patient would have been intubated at least 2 or 3 more days.
If you walk through our ICU now, you will actually see that patients who are on a ventilator will often look at you as you're walking by the room. They may motion for you to come in. They may be able to write notes. They may be able to point to a communication board, make their wishes known. All things that in almost all cases for ventilated patients would not have happened before this project.
We have all of our wonderful monitors and all these wonderful gadgets. What it comes down to, they'll tell you, it was the nurse who came, you included me in my care. It was the nurse who came in and touched my hand in the middle of the night. That is the one thing they will remember every time. So if we identify a problem and we do work to improve it, that helps the patient. And it helps us too, because now we see the results of what we are doing with our patients, and then you see the whole unit working together.
The work that we've been involved with in the last 5 years has really transformed the way that we provide care in our organization. Our nurses work in partnership with other team members, physicians, pharmacists, physical therapists, nutritionists, social service planners, and they focus overall on the best outcome for the patients. We have tools available that help the nurses' critical thinking skills, but they're a net for the way that work should be done and care provided. We want to ensure that our patients are protected, that we have a safe environment, and that we have a sustainable model for our care for the patients as we move forward.